Welcome to the Golden Canopy Health Management channel. My name is Kevin Lee, and here at Golden Canopy Health Management, we are dedicated to ensuring health, enriching life, and embracing retirement. Today, we're going to be talking about AEP, why it's important, and more importantly, how to get ready. AEP starts today, October 15th, 12:01. AEP starts. Now, why is that important? We'll discuss that. Why you don't want to miss the important updates? We'll discuss that too. And we'll also discuss what it even means and what it even is. So if you already have Medicare or if you're already on Medicare, this video is for you. If you are new to Medicare, this video is for you. If you are thinking about staying on your spouse's plan, this video is for you. So stay tuned. We'll go ahead and break everything down so you guys can be up to date and be informed. Now, first things first, what exactly is annual enrollment period? Annual enrollment period runs from today, day one, October 15th, all the way through December 7th. Now, what this means that this is the one time of the year that Medicare beneficiaries can make changes to their current coverage. Whether you're currently on original Medicare or a Medicare Advantage plan or a Medicare Part D prescription drug plan, AEP is your chance to review, switch, or even add plans to make sure you're getting the best possible coverage. So don't miss this window. Now, so let's start with those of you who are already have Medicare and how should you get ready for AEP? The first way to get ready if you already have Medicare is to one, review your current plan. This is the most disruptive year in Medicare. So you want to take a close look at your current plan. What worked for you in 2024 may not work for you in 2025. So you'll want to review your annual notice of change. Now, your NANOC, annual notice of change, you should have already received by mail back in September. So this document will tell you about any changes coming to your current plan for the next year, which is 2025, like premium increases, changes of coverage, or even new network providers. So all those information will be covered in your annual notice of change. Now, if you don't know where that is, if you don't know what you did with it, that would be a great opportunity to reach out to Golden Canopy Health Management because we can have and find this information for you to help you figure out exactly what your plan for 2024 is and what it's going to look like for 2025. So don't hesitate to reach out. The next thing you need to do is check your healthcare needs. If you are currently on Medicare, the first thing you should do, review your current plan. The second thing you need to do is check your healthcare needs. Now, I want you to think about how your healthcare needs may have changed from the past year to this upcoming year. Are you seeing new doctors or specialists? Do you need to see new doctors or specialists? Do you anticipate needing more services like physical therapy, home health care, or even surgery in the upcoming year? Those are questions that you should use to guide your decision if you should stay with your current 2024 plan and provider or switch over to a new plan and provider in 2025. So keep that in mind. During AEP, you can switch from original Medicare to Medicare Advantage plan, or you can change your Part D prescription. If you find, which you most likely will find, a better option for your prescription drug coverage. So you can also switch from Medicare Advantage plan to another new or better improved plan based on your healthcare needs. Please don't let this window close because once December 7th closes, you will not be able to make any changes to your current healthcare plan. Whatever you have, you'll have to have it until next year. So give us a call at Golden Canopy Health Management. We'll walk you through this maze and we'll help you understand everything and we'll take care of all the heavy lifting work for you, okay? Now, if you are new to Medicare, first and foremost, I want to say, welcome to the club. All right. Whether you're turning 25 or about to retire, AEP is an important time for you too. And here's what you need to know so you can also get ready. First thing, you need to understand your options, okay? Medicare can seem like an alphabet bowl of soup. You got Part A, hospital insurance, Part B, medical insurance, Part D, prescription drug, Part C, Medicare Advantage. So your job is to understand how each part works and whether you want to stick with original Medicare or go with a Medicare Advantage plan, which can sometimes be an additional benefit whenever you get a Medicare Advantage plan. And some of those additional benefits are vision, dental, or hearing coverage. So that's how someone who is new to Medicare, that's the first step you should take in order to get ready, is understand your options. The second thing you should do, of course, we don't want you to forget about Medigap. Now, if you're choosing original Medicare, and if you don't know what the original Medicare is, please go back to some of our earlier videos on Golden Canopy Health Management channel to learn what exactly is Medicare, Medigap, original Medicare. You'll learn about Part A, Part B, Part C, Part D, the whole thing. The second thing, for those of you who are getting ready to be eligible for Medicare for the first time, is don't forget about Medigap. Now, if you're choosing original Medicare, you'll also want to consider your Medigap, which is Medicare supplement plans, to help cover the cost like copay, co-insurance, deductibles, and Medigap plans can be a financial lifesaver if you anticipate needing more extensive medical care. Okay? Now, during AEP, you can choose your plan for the upcoming year. This is your window to ensure your healthcare needs will be covered starting January 1st. So don't wait until the last minute to make your decision, okay? And finally, let's talk about those who are considering staying on their spouse's employer health plan instead of jumping into Medicare. So first things first, we need to weigh in the pros and cons. If you have access to your spouse's plan, you're probably wondering if it's even worth making the switch to Medicare. The truth is, it depends, right? Some employers' plans offer great coverage, but others may leave you paying more in premiums or out-of-pocket costs compared to Medicare. You'll want to compare those costs very, very carefully, right? And it's a long document, and this is another way Golden Canopy Health Management can assist and help you on this journey. So you want to look at Medicare as a backup. Even if you decide to stay on your spouse's plan, it might still make sense for you to enroll in Medicare Part A anyway. It's typically premium free, assuming you've worked more than 10 years and you've paid your taxes. Part A, you've already paid for that while you've been working. Part A would be premium fee free, and it makes sense to just sign up for it and use it as a backup to hospital coverage. By that I mean if you went to the ER or something like that, Part A would help cover the cost of that. Plus, you'll avoid any penalties for late enrollment if your spouse retires or loses employer coverage later on. So even if you are not going to leave your spouse's insurance and jump right into Medicare full-time, I would highly recommend signing up for Part A because you've already paid for it. And in the event something happens like job loss, you won't be penalized because you've already signed up for Part A. Okay? Now, if you choose to stay on your spouse's plan, don't worry. You won't be locked out of Medicare forever. When your spouse retires or loses coverage, you'll be eligible for something called an SEP, which is a special enrollment period. Now, that allows you to sign up for Medicare without penalties. Just make sure you have a plan in place. So if you are caught off guard with your spouse losing their job or the coverage no longer working, that you know how to get Medicare without any penalties, okay? Now, I do want to cover some common mistakes and what to avoid during AEP. Now, let's talk about some of those. First, not reviewing your plan is the number one common mistake and I want you guys to avoid doing during AEP. One of your biggest mistakes people make is sticking with their current plan without reviewing changes. Now, 2 out of every 10 seniors actually bother at looking at the changes in the plan. Now, if you are happy with your coverage, make sure you check for any changes in your premium increase, co-payments, deductibles, or even network providers before locking in your decision. Because what was covered in 2024, say for instance you had dental and vision, or you saw Dr. Smith, for instance, Dr. Smith may no longer be covered under your current plan. You may not have vision or you may not have dental. So please, please, please take some time to take a look at your current plan. Avoid that biggest mistake. Waiting until the last minute is another big mistake people do. We get it, life is busy, but waiting until December 6th to figure out your plan for the next year is a recipe for stress, anxiety, and feeling overwhelmed. So start early, review your options, and get any help you need before the deadline. Reach out to Golden Canopy Health Management because we can help you with that. Number 3, the third mistake people often make is they're not comparing costs. Now, it's easy to assume that your plan or the plan that you had in 2024 is still the best plan, but every plan that I've seen, every client that I've helped, the plan they had for 2024 does not work for 2025. So I'm telling you, please take a look at your options. Please take a look at your plans to make sure it's still a good fit. All right. Now compare your current plan with other available plans in your area to make sure you're getting the best value for your money. Now, if you're feeling overwhelmed, don't worry, guys. Don't worry. Golden Canopy Health Management is here. This is what we do day in and day out. This is what we love to do. We genuinely believe that seniors are America's true national treasure. So we know how to navigate AEP. We can take your hand and guide you through this difficult maze, but we'll guide you through the process of finding plans step by step, understanding the new ones, understanding your old one and why your old one won't work anymore. If that's the case, depending on your health, depending on what your needs are. Now, whether you need help comparing plans, understanding your Medicare options, or figuring out the best choice for your unique situation, Golden Canopy can help. We've got your back. Now, you can reach out to us at goldencanopyhealth.com. Call us at 720-927-6891, or shoot me an email at Kevinly, KEVENLY, at goldencanopyhealth.com. Now, we're here to make sure your health management journey is smooth, stress-free, and tailored to your needs. Okay? So thanks for watching. If you find this video helpful, please don't forget to like, subscribe, share with your friends. We've got more helpful videos coming around during this crazy 45-day AEP enrollment period. So until next time, reminding you to take charge of your health, embrace retirement, and make the best decision for your Medicare journey. See you next time. Thanks so much, and have a wonderful evening.